going to go ahead and get started, everyone. I want to welcome you. Good evening. My name is Marcy Taylor, and I am the chair of Zeta Phi Beta Sorority Stork's Nest. Just a little bit of background. Zeta Phi Beta Sorority and the March of Dimes has a respected and enduring partnership and legacy of addressing issues of prematurity, birth defects, and infant mortality. The March of Dimes has identified November as Prematurity Awareness Month, and the entire month of November, we are happy to say that we're doing Moms Stay Woke Part 3, conversations with young women about childbirth. And we also want to thank Nurse Family Partnership for partnering with us during this Prematurity Awareness Month. So this is happening every Wednesday at 6 p.m. And if you attend at least 4 of the sessions, you will be entered into a drawing for some swag. So it's going to be a basket with some NFP items. There's going to be a self-care kit. There's going to be gift cards to Generations Adventureplex, a gift card for a manicure at Nailed by D, and a $100 gift card to Therapeutic Indulgence. So in case you missed it, last week we were talking about preeclampsia, and we had Marshall, who is an NFP certified doula. She was talking about that. And if you missed it, it's on our YouTube page, and you can follow us and subscribe. So this week we're going to be talking about preterm labor, and I'm going to introduce Christina in a little bit. Week 3, we're going to be talking with a NICU nurse. Week 4, we're going to have a couple of ladies talk about their stories, pregnancy. Week 5, we're going to have support groups and programs talk about what they offer. And after each session, we're going to have a question and answer session in case you have any questions. So before I introduce the speaker, I didn't know if anyone else, I'm going to give everyone a chance to introduce themselves. Kaylee, you want to start?
Sorry. My name is Kaylee, and I am 25 weeks, 1 day pregnant.
25 weeks, 1 day. Okay. And when's your due date?
February 21st.
And do you know if you're having a boy or a girl?
Both.
Oh, you're having twins?
Yeah. Yes.
Congratulations. Wow. Okay. Next.
My name is Tamara. I am technically 36 weeks today, and I'm a first-time mother.
Well, congratulations to you. Do you know if you're having a boy or a girl?
I am having a boy, and his name is Zane.
Zane? Okay.
Yes.
Congratulations to you.
Thank you.
Carla Phillips.
Okay. Hi, my name is Carla, and I am 26 weeks and 3 days, and I am having a boy.
And congratulations to you.
Thank you.
You're welcome. We have Carrie Purdue.
Hi, I'm Carrie. I am a nurse home visitor. And I work in Elkhart County. So all my clients are in Elkhart County, and I have a couple that are in St. Joe County.
Okay. Are you part of NFP?
I am NFP. Rochelle is my supervisor.
Okay, great. Thanks for being on the call.
Yep.
We have, I'm not sure if Rochelle is available or if she was, I know she has something going on.
Yep. Oh, sorry. Okay. I'm not going to turn my camera on because I got a half naked baby with me, but
okay.
So I am Rochelle. I am the nurse supervisor with the NFP. And I've been with the NFP for 3 years, started out as a nurse home visitor. So very familiar with the program and, you know, all the great things that we do to support our mamas.
And thank you for that support, Rochelle and NFP. And then we have President of Zeta Phi Beta Sorority, Alice.
Good evening, everyone. Thank you for joining us this evening. I am the current president of the local chapter of Zeta Phi Beta Sorority Incorporated, and I look forward to this session. Thank you very much.
Thank you. And now I'm going to introduce the speaker for this evening. We have Christina Imch. I hope I said that right. She joined Beacon Health System as a practicing certified nurse midwife in April of 2020. She studied nursing at the University of Indianapolis and began her nursing career at Riley Health in labor and delivery. She's a mother of one daughter, and she loves Halloween, and she begins dressing her daughter up for Halloween very early in October. So, Christina, it's all yours.
That's cute. Yeah, I was showing off pictures to Leslie, so I'm sure that's cute. All right, hi everybody. Like they said, I'm just gonna start the slideshow here. My name is Christina Empt. I'm a certified nurse midwife, and this presentation is about preterm labor and birth. And you all can see, are the slides changing okay? Okay, wonderful. So yes, I've been an RN since 2012. So certified nurse midwives. There's different types of midwives, but we start as nurses first, and then we go back and get like our master's in midwifery. We take care of normally low risk patients, but we do have some patients that have some high risk, things, and we collaborate with physicians if needed. But I do have a background. I worked in labor and delivery at a pretty large hospital in Indianapolis from 2016 to 2019. And then, as they said, I've been a certified nurse midwife since 2020. Started the pandemic. Very fun. So just wanted to start with some definitions, preterm labor versus preterm birth. So preterm labor are labor symptoms before 37 completed weeks of pregnancy. So anything from, like preterm contractions to your water breaks early, your cervix starts to dilate, and then a shortened cervix. So if the cervix is the end of the uterus where the baby comes out and the part that dilates, so normally it's pretty thick, like we can, like almost like a little mini donut, if you're looking at it, head on. So it's normally like pretty thick, then it gets thin as pregnancy goes on. So if it's starting to get thin early, that makes more at risk of dilating faster. So definitely watch our moms if we see any of that. And then preterm birth is, giving birth before 37 completed weeks of pregnancy. And this is a picture of my daughter. When she was born, she was not born preterm, but she was pretty tiny. She was 6 pounds 1 ounce. So signs of preterm labor. These are not exhaustive signs, and I hate this first one because I find that your vaginal discharge does change in pregnancy, but I'm talking about like, bleeding in pregnant, or, vaginal bleeding. You think your water's broken, it's really watery, or there's a foul odor, things like that. Other signs can be lower back pain, and again, that's kind of hard because you have low back pain sometimes in pregnancy, but again, I'm talking about like severe, dull, low back pain normally. Abdominal pain versus contraction pain, it could be not as obvious as contractions, but definitely if you're feeling contractions. So if contractions normally like come and go, compared to abdominal pain can be more like constant, but normally like low abdominal pain, especially if it's wrapping around to the back or vice versa. And of course, leaking of fluid if you're afraid your water's broken. Preterm birth rate in the USA. So these are the most recent statistics I could find. Most of these are from March of Dimes website. So in 2020, the birth rate in the USA was 10.1%. 2021, it increased to 10.5%. And then preterm birth rate in Indiana, where I'm from, is about the national average, so 10.4%. And then, so that's like really, that's 1 out of 10 births in Indiana at preterm. And then unfortunately, this has been kind of an ongoing issue and a topic for another day, but if you even break it down to race, African-American women, the rate is almost double, compared to Caucasian women. So according to March of Dimes, in 2018, 2020 average, it was like 14.2%. In 2021, the preterm birth rate among African women in the United States was even higher, so 14.8%. And that's according to the Division of Reproductive Health and the CDC. So who's at risk? Really, anyone can be at risk. Especially if it's your first baby, we don't know who's necessarily going to go into preterm labor or have preterm birth, but we know some risk factors, of course. So known risk factors are, if you've had a premature birth or labor in a previous pregnancy, pregnant with multiples, so twins, triplets. Again, kind of touched on the if there's problems with your or issues with your uterus or that the cervix is short. Others, starting with your pregnancy, underweight or overweight, family history of premature birth. So it's really good to talk to, your sisters, your mom, and ask even specifically why, or like what happened. Were they like induced early, or did they go into labor early if they had a premature birth? Closely spaced pregnancy, I see this the most. Not all closely spaced pregnancies end up in preterm birth, but less than 18 months. So it's very important. Pregnancy is really, really hard on your body. And we really encourage to kind of space out that pregnancy at least, a year, 18 months, because your body needs to recover. It's a lot to go through that again so quickly. Medical risk factors, anything from diabetes, high blood pressure, which can lead to preeclampsia, infections mainly in the vagina or uterus, drug and alcohol use. And I think when we think of drugs, what comes to mind are like the hard drugs like heroin and opiates and things like that, but even can be tobacco and vaping can also put you at risk of preterm labor. Stress, late or scant prenatal care, domestic violence or abuse, and then the age, the lower limit age is kind of up for debate. Some people say 17, some people say 20 or whatever, but then around that age, and then greater than 35, and then race again, as we kind of touched on earlier. This is according to Marcia Dimes and Stanford Medicine. Risks of preterm labor to the baby, trouble staying warm. So babies at the beginning, they don't have much fat on them, right? And the fat, fat is good. We want nice little chubby babies that helps them stay warm. Breathing problems. There's different chemicals that help the lungs kind of open up, because when they are in the womb and compared to when they're born, it's totally different how they breathe. They practice breathing. You might see that if someone does an ultrasound and they might mention that or something, they're practicing breathing. But again, it's totally different mechanism and totally different. There's a specific chemical that helps their lungs kind of open up that develops, more towards the middle and end of the pregnancy. So if they're born early, they could have breathing problems. Blood disorders, anything from like anemia to jaundice, low blood sugars, kidney problems, because it's still, working on developing, poor feeding. So again, another thing that they have to kind of switch when they come out of the womb is how they eat. Right now they're just getting their nutrients from you, but when they are born, they have to learn how to suck and swallow and breathe and coordinate that together. And that can be very difficult for preterm babies. Motor disabilities, including things like cerebral palsy, hearing or vision problems, which can be lifelong, bleeding and brain or seizures, and death. Unfortunately, in Indiana, 34.9, this is according to Marcia Dimes, 34.9% of infant deaths that were related to preterm conditions or preterm related causes were the result of infant deaths in Indiana. And this is an average from like 2017 to 2019. 34.9%, that's almost close to like half the deaths of infant deaths in Indiana. That's a pretty big percentage. And then all of these two risk factors, more likely the baby's going to be admitted to NICU, and that's, extra cost, extra monitoring, could be separated sometimes from your baby. And I think you also want to keep in mind, different hospitals have different levels of NICU and of like the limit of the how young a baby they can take care of. So that's also important to, know your risk factors, know if you're in preterm labor, so you can be at the appropriate hospital. And again, according to Stanford Medicine, generally the more premature the baby, the more serious and long-lasting the health problems. So what can you do to reduce your risk? Kind of like I said before, know your risk factors. There's of course some risk factors that you can't control, but you can modify hopefully some that you can. So, like smoking or your weight, seeking prenatal care early. There's things we can do if we know you have a history of preterm birth. Sometimes there's medication we can start giving, but if we want to start that at a certain point in your pregnancy, if we know that, it doesn't really help like later on in pregnancy necessarily. We can get that early ultrasound and start looking at your cervix, making sure it's not shortening, things like that. So definitely encouraged to seek prenatal care early. What is early? Some people ask, ideally would love to see you in your first trimester. Every institution is going to have a different like gestation of what is late prenatal care, but I don't know, rule of thumb for me is, before 16 weeks pregnancy is ideal. And then go to your appointments. Again, if we don't know what's going on, or, you might mention something and, oh, I think I'm kind of leaking fluid, but I'm not sure it's vaginal discharge. I just had a patient today that was leaking, she thought it was just vaginal discharge, but it really was. Her water was broken and she was 30 weeks. So very glad that she mentioned that to us and didn't just put it off, and we got her admitted, and including postpartum, because again, normally around that 6-week postpartum visit is when, we offer birth control. So I know birth control is not for everybody. There's not any perfect birth control for sure, but what kind of things can we do to help you space that pregnancy again to reduce your risk of preterm birth and labor? And those are my references. Alrighty. Anybody have any questions?
No.
Okay, no one with any questions?
No, from Lauderdale, first time mom, no questions.
Nothing? Okay.
Okay.
No, I know a little bit about it just because technically they thought that I was going to go into preterm labor due to my short cervix. So I've been reading up on it. My doctors, I've been going actually at the beginning of 20 weeks, every 2 weeks to an anatomy scans, or ultrasounds, just to verify, making sure that I don't go into preterm labor. So I've been taking precautions as of right now. So it's just good information just to go over and refresh my memory.
Yeah, that's great. I'm glad that
Yes.
you're getting good care.
And
Yes, ma'am.
Kylie, is it Kaylee or Kylie?
Kaylee.
Kaylee, with twins.
Yeah, I was not expecting that either.
Yes. Wow. Christina, is the percentage higher for preterm with twins, triplets, and things to that nature? Is it significantly higher or just a slight?
I can't say the percentage off of my head, but I'd say it's very unusual for them to go term, but it's also like there could be there's so many different variation or things that they could be induced early for twins, because you have 2 babies. There's double the chances of something going on. So they sometimes are induced. So I feel like that number's a little bit higher just because of the rate of inducing labor. If there's like a medical problem for twins and triplets is higher than normal pregnancies.
Okay. And usually like the inducing, is that kind of like maybe 3 weeks, or is it usually longer than, quicker than that? Is it like 2 weeks usually? I know it depends case by case, but I've always heard, just ones I've known, they've always went early. And I was just trying to kind of get an idea. Is it like a month early or something to that nature? So I was just trying to get that.
Like when they're induced?
Mm-hmm.
Yeah, it's case by case.
Okay.
So, how severe what's going on, if they have I think your twin to twin transfusion where one twin is getting more nutrients than the other. I think that's the most severe situation that they would induce early. So that could be almost like 32 weeks depending how severe or bad that is. But I think they really try and get them at least 34 or 36. We try as long as we can, but the risks and benefits depending what's going on.
Okay, thank you.
Yeah.
Christina, could you address what happens if these women go into preterm labor and they go in and get checked? What happens next if they truly are?
Yeah. So like I forget, sorry, who said that they had the shortened cervix again. If it's depending how short it is and or if it's getting, worsening, did they have any like medication like progesterone or?
Yes, ma'am. I've been taking progesterone since 20 weeks.
Perfect.
And I haven't been before then I wasn't dilating or it wasn't open, but they just make the precaution to make sure that I've been taking it just in case. And I'm 36 weeks this Wednesday, and next week they told me that I can stop next week. So
perfect. Yeah, something, different things like that. Sometimes it's just kind of a watch and see if it gets the risks increase. But things like if your water breaks, depending kind of where you are, if the baby's viable or, has better chances of surviving if they were to be born early. Normally we would admit you to the hospital because the risk of infection increases the longer that you're ruptured, and you would get like antibiotics, sometimes some medication, the rescue steroids that helps with the lung maturity. So that's something else you could probably expect. Most people, if we're afraid, have good suspicion that they might deliver in the next 7 days, we can give them 2 doses of a steroid that helps with the baby's lung development. So yeah, you don't always get admitted, but if it's things like your water breaks or like we're really, we're scared that you could deliver, and we don't want you to deliver at home because would be terrifying to have a baby preterm at home, then there's possible admission to the hospital, but we try our best to, if it's things just to watch and wait, to, follow up with more frequent office visits or medication or things like that. So again, kind of case by case, but usually just more frequent monitoring if they can be monitored outpatient.
Okay, thanks for sharing all that information, Christina. I want to thank you for taking the time out to share your knowledge with our ladies about preterm labor. Are there any more questions?
No.
None? Okay, then we're done for today. Just reminding you, next week, we're going to have a NICU nurse in, and I believe they're going to talk about the ABCs of safe sleep. We're going to have 2 ladies come in and they're going to talk about their stories, and that's week 4. On week 5, we're going to have support groups and programs. And just reminding you, if you attend 4 more sessions, you'll be entered into a drawing for that swag. So with that being said, we are done for this evening.
All right. Thank you so much for having me.
Thank you.
You're
Thank you.
welcome.
Thank you.
Everybody have a great night.
Have a
Thank
good
you.
one. Bye-bye.
Thank you.